Okay, so today we are going to discuss about pancreatic disorder. Okay, so pancreatic disorder. Pancreatic disorder is a common trouble, common disease, common disorder for everyone, right? But not really have people will put the focus point on that. Mostly we are focusing on liver lah, kidney lah, lung lah, right? But people, we may not know that pancreas is actually also a very important and also troublesome organs, right? Many disease, especially the diabetes disease, are highly related with pancreas disorder. Okay, so today we are going to touch about this very unique organ, and so to provide more information about that. All right, so pancreas is the horizontal. It's a horizontal organs in our inside our abdomen, and a bit to the back. Okay, a bit to the back. So hiding behind our stomach there. Okay, so it's about 6 inch long. So in Chinese we call it the ruler of your waist. The ruler of your waist. Okay, so it's about 6 inch, and the functions of the pancreas, mainly pancreas has two major functions. One function is to secrete the digestive enzyme, and another function is to secrete the insulin hormone. Okay, the blood, the glucose regulations hormone. Okay, so this is the two major functions of pancreas. Okay. All right. So pancreatic cancer is famous as the king of cancer. You see, pancreatic cancer is not a major cancer. Actually, it's not a major cancer. It ranks about number 11 or number 12 in the world for all cancers. Yeah. So it is not a major cancer. In compared to liver cancer, in compared to lung cancer, it is considered quite rare. But pancreatic cancer is famous as a king of cancer because of the 5-year survival rate is only 9%, which means if 10 people is having this pancreatic cancer, right? In 5 years survival rate, 9 of them will gone, only 1 left. Okay. Only 1 left. So this is the most deadly cancer of all time. We can put it like that. Okay, we can put it like that. The most deadly cancer of all time. Pancreatic cancer in the world, right? In the world, the estimated death in 2020 is about 250,000 people, right, is dying by the pancreatic cancer. Okay, although the number is not that much, right, in compared to 8 billion of population in the world, we only have 250,000 people are dying by pancreatic cancer. Okay, but because of the high mortality, right, so it makes this type of cancer become very scary. People are quite scary. This is why quite worried about that. Okay, so in this chart you can see in the total mortality, half of them are Asia, right? So which means for Asia we are most likely to have this pancreatic cancer more than European, more than American, more than African, more than Ocean. So Asian is having the most cases of this pancreatic cancer. Okay. So before we go into this pancreas itself, we have to understand the relationship of pancreas. So pancreas is part of the endocrine system. Okay, endocrine system, so-called endocrine, which means those organ secreting these hormones. Usually we call it as an endocrine system. So like your pituitary is the endocrine system, one part of the endocrine system. Your thyroid is a part of the endocrine system. Your pancreas, livers, even kidneys, right? So all these are considered as a endocrine system. So for the pancreas is working highly correlated with all these few organs. So pancreas is working with stomach, working with liver, working with gallbladder, even working with our intestinal system. Okay, mainly because of all these are also considered as a part of the digestive system. The main organ of the digestive system is our stomach and our intestinal. So that's why we call it gastrointestinal system, right? But the secondary organ, supportive organs, will be the gallbladder and the pancreas. Okay, so the organs we know that the liver, we know that it will secrete this gallbladder bile, the bile from the gallbladder bile, the bile, and then secrete to the gallbladder. It will keep into the gallbladder. When we take a lot of this high fat food, when we took a lot of this a lot of animal fat, then the body will secrete bile. Okay, our bile, and then the bile will help us to digest all the fat. Okay, so the liver will secrete bile, and then the bile will keep in the gallbladder. And then the pancreas. The pancreas, as I say, the pancreas has two major functions. One is to secrete the digestive enzyme, and another is to secrete the sugar regulations hormones. Okay, so all these are related to the digestive. Okay, to the digestion. Okay, so this is the neighborhood. So everyone is very important, and they are affecting each other. Okay, so the consequences you will know in the in upcoming slides. See, this is anatomy of our pancreas. Don't have to remember that, not so important. Just mainly to let you know, have a picture on that. So for the pancreas, is something like that, like a cone in your body. Okay, complete cone in your body, and we have the head of the pancreas, about 4 parts: head, neck, body, and tail. Okay, not so important. Okay, not so important. Just for illustration. Okay, for this, we should know that in our pancreas, we have some cell, right? As in a cell, which is to secrete this digestive enzyme, and these are islet cell. Islet cell is to secrete all these like glucagon, insulins. Okay, all these related, all these sugar regulations hormones. Okay, so this is what we can see, and you can see the red dot. All the red dots are our islet cell. All these islet cell, we only have not more than 10% of islet cell. Okay, so very rare in the body, and the islet cells are mainly to produce insulin. Okay, about 65 to 80% of islet cells is used to produce insulin in the body. Okay, so we have only the most, not more than 10% of total cells in the pancreas can build, can secrete this insulin. So we need to take care of this kind of cell very carefully. Okay, so when we secrete the cell, this is a bile duct. This is the pancreatic duct. Okay, so whatever we are going to secrete, it will come out from here, from the pancreatic duct, and then meet the bile ducts together. They are using the same outlet. They are using the same outlet, so everything will secrete into this duodenum. Okay, so we secrete into the duodenum, then the duodenum will do further digestions program. Okay, so basically the pancreas, two major functions. One is to regulate the blood sugar, another is to digest of your food. That's why when we so the endocrine, so we have endocrine and exocrine, these two type of functions. So endocrine will mainly point to insulin, glucagon, and this somatostatin. Okay, so insulin, basically insulin is to promote the blood sugar, to uptake the blood sugar by your cell, okay, by the cells. Okay, so insulin is to promote the sugar uptake, and glucagon is to promote the to promote the sugar in the liver to be converted back to the glucose. Okay, to be converted back to the glucose. So insulin and glucagon, these two functions, and somatostatin is mainly to stop these two hormone production, because sometimes when we cannot have too much of insulin, and also we cannot have too much of glucagon. So we need something, but the pancreas only know how to produce, don't know how to stop. Okay, so we need something to inhibit it, right? So the somatostatin will be there to stop the insulin production or to stop the glucagon production. So it's a regulator. Okay, somatostatin is a regulator. So mainly we will focus on insulin and this glucagon. Okay, so these three hormones are for blood sugar regulations, and for the digestions. When we take some food into our body, we need some digestive enzyme, not only the gastric. Okay, the gastric is one very important thing to melt our food, to digest our food in our stomach. But not everything can be fully melted, and not everything can be fully degraded to become the nutrients. So the food after the progress in stomach, all right, it will further pass to the duodenum, all right, and at duodenum we need something to further break down, like protein. If today you take a protein, you take a meat, all right, the meat goes into the stomach, then your gastric will melt the meat, will do some digestions. Then further it will pass to the duodenum. In the duodenum, the protease has to come out from the pancreas, because the protease is further to break down our protein into peptide, into this amino acid. Okay, so this is what we need for breakdown. So protease, we need protease to break down the protein into peptide, into amino acid, and then we need lipase. Lipase is to break down the fat, break down the molecules, break down the fat, and then to become small change, short change. Okay, easier for body to absorb. And we need also amylase. Amylase actually we can produce amylase by our saliva. The saliva can produce amylase. Amylase mainly to absorb the carbohydrates. That's why when you take a spoon of rice, immediately your blood sugar will rise. Don't have to wait. There's you don't have to wait for the the digestions. Okay, so after you take 1 spoon or 2 spoon or 3 spoon, and immediately the blood sugar will raise because of our saliva and our glands here. We will start, and the mucus under the tongue will start to do some absorptions. Okay, so when we take rice, we take bread, we take roti, blood sugar directly raised. Okay, so don't have to wait. Okay, so we need amylase. So after the saliva produce amylase to absorb part of the carbohydrates, but not all. You see, as a 1 spoon of rice, it contains 87% of carbohydrates. So not all can be absorbed by our saliva, by our mucus under tongue. So we will further go down to pass through the stomach and then goes through the intestinal. Then further it will, with the amylase, further break down the blood sugar, convert the carbohydrates into the simple sugar, which is the glucose that we need. Okay, that we need then to further absorb. So we need these three enzymes to help us to do digestions. So people, if you have digestive problem, maybe one of the trouble is the pancreas is not really functioning on secreting, on producing the enzyme. All right, so this may be one of the problems. Okay, so basically we have 2 major functions of for pancreas. So very easy, not that complicated. Pancreas work is not that complicated like liver. Liver has to do a lot of work, has to do a lot of things like synthesis, even synthesis and then converting, and then detoxifications. All these have to be done by liver, but pancreas is simple. Okay, mainly to secrete the hormones and the digestive enzyme. Okay, so we have islet cell and acinar cell. So islet cell, we have a few cells. Don't have to remember this. All right. So we have a few cells. We have alpha cell, beta cell, delta cell, gamma cell. These are epsilon cell. What you have to understand is, remember is the beta cell, because this is the most in the islet cell, and this beta cell is producing the insulin. So whether you are having sufficient insulin or not, it depends of your beta cells quality and quantity. Okay, so insulin from the beta cell. Glucagon is from this alpha cell, and somatostatin from delta cell. Gamma cell also calling 𝗵𝗵 cell, which is a pancreatic polypeptide. This one also regulating the blood sugar and the enzyme secretions. Okay, so these 2 also important. Epsilon cell produce a GH renin. For your information, that GH renin can be produced. Most of the GH renin is produced in the stomach, and GH renin is a hormone, right? It's a hormone to make you feel hungry, to make you eat more carbohydrate. So GH renin basically is a carbohydrate, is a sugar demanding hormone. All right. So today, if you go for a restaurant, there's a simple way, SOP by taking all kind of food. Now you have rice, you have meat, you have vegetables, you have some nuts. Okay, so what you should take first? Usually people hungry, they will, when they go to the restaurant, the first thing they will take the rice. Once you take the rice, the GH renin will be secreted. More GH renin will be secreted in the stomach, and the body will demand more rice. That's why if you eat rice, you can continuously eat 1 bowl, 2 bowls, 3 bowls. Right? Many people can eat a lot of rice. Okay, but if you taking this meat, if you if you we started with the meat, right? When you intake the meat, the GH reeling will not be secreted, but it will trigger another hormone, which is we call it leptin. Leptin will be secreted, and leptin is a protein hormone. It's a reduce hunger. The hormone to reduce hunger. It will make you feeling full. That's why if you go and eat a piece of steak, hardly you can take second piece. Okay. Most of us, we only can take one piece of steak. Hardly we can take 2 pieces of steak. But if you go for, if you take sweet, if you take carbohydrate, you will find that continuously you will keep on eating and eating and eating, right? Carbo and candies, chocolates, cake. People are eating more. But when talk about protein, like eggs, in the morning you take 2 boiled eggs, it can make you full until afternoon. My experience, 2 eggs can make me feel full until afternoon, until 4, until 5. Okay, so sometime when I have a bit late breakfast, like 10 or 11 something, I take the eggs, 2 eggs only. It make me full until the dinner time. Okay, so this is GH reeling. All right. So mainly you have to remember the beta cells. Okay, because beta cell is very important for us for the insulin secretions, and the insulin secretion is very much highly related to your blood sugar level. Okay, so the insulin quality, the quantity and quality of the insulin is highly related to the blood sugar. Okay, so for Athena cells, simple lipase, protease, amylase, all these I have explained just now, so I'm going to skip it. So what is the common pancreatic disorders? Pancreatic disorder, we are having this pancreatitis. Okay, pancreatitis is one of the common pancreatic disorder. We are having this pancreatic cyst and tumor or cancer, all right, which is extra thing happen in the pancreas, or making your making your pancreas become swollen, having some cyst or fruit accumulate in the pancreas, making it out of shape. All right, so pancreatic cyst or tumor cancer. And we have this diabetes mellitus, also kind of pancreatic disorder. Okay, so what we have in pancreatitis. Pancreatitis is, put it as simple, pancreatitis means the pancreas is inflammation, it's in inflammation. Okay, so inflammation, that we have acute inflammation and we have chronic inflammation. This one already, we already told in the in this module 1 and module 4, okay, about the immune system. When we're talking about discussing about the inflammation. So we have acute inflammation and we have chronic inflammation. Every body part will have acute inflammation and chronic inflammation. Like even pancreas also having acute pancreatitis and chronic pancreatitis. So for the pancreatitis, mainly we have 3 main reasons to cause us to have this pancreatitis. Okay, the first thing is because of the digestive enzyme. The digestive enzyme is not successfully flow into the body, flow into the duodenum. All right, and then it flow back inside to your pancreas. So it make your pancreas become inflammation. Okay, and second thing is, of course, we are always talking about the oxidative stress. People are taking a lot of sugar, a lot of highly inflammatory foods, omega-6, and what else? And drinking a lot of beer, a lot of alcohol. These are smokers. All these are putting a lot of oxidative stress, putting a lot of free radical attack to the body. So one of the organ can easily be attacked, which is the pancreas. Okay, so and the third reason, main reason of having this pancreatitis is because of autoimmune attack. Okay, so we have acute pancreatitis, we have chronic pancreatitis. These three reasons may cause you have acute pancreatitis, may also cause you have chronic pancreatitis. It only depends of how much serious on it, right? People have acute pancreatitis, may not have chronic pancreatitis, but people have chronic pancreatitis may develop to acute pancreatitis. For example, people used to drink beer. Alcohol will cause a pancreatitis beside hepatitis, okay, liver inflammation. Alcohol will also cause you to have this pancreatitis, okay, pancreas inflammation. And if you rarely take beer, take alcohol drink, but one day because of your best friend wedding, you have to drink a lot, drink a lot, then you may get acute pancreatitis. Or beside the acute liver inflammation, you may get the acute pancreas inflammations. Okay, and the same thing, if you are alcoholic, right? You drink alcohol almost every night because you have a lot of friends, right? You are very kind. You always buy beer for people. You love to spend time with your friend by drinking beer. Okay, so then a consistently long-term of misuse of alcohol products, it will make you to have this chronic pancreatitis, because daily a little bit alcohol will create the slow inflammations to your pancreas. Okay, so if you are having acute pancreatitis, you may not have to go through the chronic part. But if you are chronic pancreatitis, one day when the immune system cannot hold anymore, then the chronic pancreatitis will trigger by some small issues, and then to become an acute pancreatitis. Okay, so same factors, it may cause you acute or it may cause you chronic. It only depends on how serious on it only. Okay, whatever it is, both are pancreatitis, and both are having chances to develop to pancreatic cancer. Okay, so pancreatitis is just like liver, like hepatitis. Hepatitis is a staging process, one of the staging process to become liver cancer. Same thing, pancreatitis also one of the stage to become this pancreas cancer. All right. So fast explanation: acute pancreatitis, sudden inflammation. Usually it will come suddenly, and just like I say, suddenly you take a lot of alcohol, so it make you have this sudden inflammation, and this sudden inflammation can go very fast. Okay, can go very fast. So this is only lasts for a short time, and then the pancreas may return to normal. But it will, once you hurt your pancreas, okay, the scar will be there. Okay, with the scar will be there, they will become very sensitive, easy to be hurt again. Okay, so we will create a lot of problem in future. Okay, this is acute pancreatitis. And chronic pancreatitis, long-term inflammation, and you may not know, you may not feel that. Many people are having chronic pancreatitis, and they may not know that they are actually having that. Okay, like what? Like people are having this. People are having diabetes. People are having diabetes. Most of them are actually the inflammation, the disorder of the pancreas, and most of them are because of the pancreatitis. All right, chronic pancreatitis, making the pancreas is out of order, not secreting sufficient insulin, or secrete too much of insulin but low quality. Okay, so this is a chronic pancreatitis. Okay, and chronic pancreatitis will cause a permanent damage to the pancreas. Yeah, of course, and slowly it will make your pancreas become make you a lot of scar, make it hardening, turn your pancreas cells into tumor cells, into this cancer cell. So both are actually having the chance to proceed to further to this pancreatic cancer. All right. So what will cause the pancreatitis? Now, the most common cause of pancreatitis include alcohol abuse. As I said just now, alcohol is one of the reason people are alcohol drinker. You have to take care, beside the liver, you have to take care of your pancreas as well. Okay, so the pancreas will be harmed by the alcohol as well. Okay, another one is a gallstone blockage. Why gallstone blockage? Later I will explain to you why gallstone blockage. Gallbladder stone is formed in your gallbladder, or is formed in your liver. Okay, it's formed in your liver, and then the gallbladder stone will flow out. It will flow out. Okay, flow out, because the body will try to eliminate all these unused product. So like gallstone form into the body will try to eliminate it, eliminate. So it will, by normal way, it will secrete push the gallstone to the outlet, then fall into your intestinal, follow with your stool to come out, your stool to come out. So, but sometimes the gallstone is not successfully flow out, stuck somewhere else. Okay, stuck somewhere else. So it will causing the blockage, and this blockage can be deadly. Okay, can be deadly. So please don't think the gallbladder stone is not serious. It can become very severe. Okay, so, and other causes of pancreatitis include this belly injury, surgery, the high level of fat particles. So if you're having high triglyceride, just think about that. If you're having high triglyceride, the triglyceride surrounding your liver also near to your pancreas. So your pancreas function will be affected as well. Okay, so high level of calcium in the blood are people who are having this pancreatitis. They may have this hypocalcemia problem. Okay, so hypocalcemia. So people who are having pancreatitis, they may easily develop the osteoporosis. Okay, so people who are having a high level of calcium in the blood, they also may indicating they are having this pancreatitis. Okay, and like medicines, okay, estrogen, steroid, okay, diuretic drugs, all this will also cause a pancreatitis. Okay, drugs will also always harmful to the body. Infections, okay, infection. Mumps, what is mumps? Mumps is the glands produce saliva. Okay, when you're having some swollen over there. Okay, this is a mumps. Okay, and hepatitis A or B, Salmonella. Salmonella is a virus that causing you diarrhea. This is a very common virus. Okay, very common virus, very common bacteria. We always contract because the Salmonella is in the contaminate water and food. And food, if not well fully cooked, is a food if raw food or semi raw. Those like chicken, like pork, okay, and semi cooked or not fully cooked or raw food, it may contain this Salmonella as well. Okay, so sometimes why we have diarrhea when we eat something, then we found that, oh no, we will call it that what food poisoning, something. Yeah, can be a food poisoning. Salmonella, we can put it as a food poisoning symptom as well, because it is the virus triggering the diarrhea. All right. So, but usually most of us we can recover. Salmonella is not a deadly virus, not the deadly bacteria. Okay, and cystic fibrosis, which is happening in the pancreas. When your pancreas is having cyst, right? Having cyst, then the cystic fibrosis will further promote to pancreatitis as well. Okay, tumor, of course, and genetic defect. This is from mainstream. We will always use the genetic effect as one of the reasons. Of course, we agree that genetic Genetic will be one of the issues, one of the factor. But as I say, if you are not triggering the problem, the genetic defects may not happen. Okay, so which means if you are having if your parents is having pancreatitis, yeah, you may have the gene for easier to get pancreatitis. But if you take care of your body, you take nutrients, you take care of your dietary, you take care of your lifestyle, then of course the genetic issue, genetic factor will be lowest to the minimum. Okay, so genetic is a factor, but I would say genetic not the main factors. It can be controlled. Congenital abnormalities in the pancreas and trauma to the pancreas, cigarette smoking, all these are giving oxidative stress to your pancreas. Okay, so this is a causes of pancreatitis, right? Mainly because of alcohol and gallstone. What we can find that in most of the cases are causes by these two major factors. So for alcohol abuse, we are not going to talk about that, right? Nothing much to talk about that. All right. As long as you know that taking alcohol drink is not good to us, is not healthy to us. So the best is to avoid not only pancreatitis. If you're having a hepatitis, you're having this kidney disorder, you're having a cardiovascular disease, Parkinson's, all these things, we should not take alcohol, right? Alcohol drinks, well, alcohol drink is a factor to harm the body, the whole body, not only one of the organs. Okay, so alcohol, we are not going to talk about that. We will focus on this gallstone pancreatitis. Okay, see, as I say, look at the center image. The pancreatitis, you see the gallstone. The gallstone is formed. This form in the gallbladder. Okay, the gallstone form in the gallbladder, and then the gallbladder will secrete, when secreting squeezing the bowel, right? It will also at the same time, it will squeeze some stone to flow out to this bowel duct. Okay, this is a bowel duct. Okay, so the bigger stone may stuck somewhere else. All right, may stuck somewhere else. So if the stone is stuck over here, this only stuck in the bowel duct, it will only cause you to have this bowel deficiencies. Okay, bowel deficiency, and making you not so effective to digest the fat, to absorb the fat. Okay, this is one of the reasons if you are having malabsorption of fat. Okay, so this is and then the high concentration of bile duct, high concentration of bile, it will further to form the more stones. Okay, it's form more stones. That's why if you're having some obstruction in the bile duct, the more stone will coming up. Okay, so start from one stone, you will form a few stone, and then more stone and more stone and more stone. Okay, so people, if you saw my own stones before, my stone before the pictures, okay, then you will know that how much stone that we can produce. Okay, we have I have a solution to help you all to do this liver detoxifications. Okay, which is the bowel stone the gallbladder stone detoxifications. Okay, so this one we can teach. Maybe we'll find a day I can teach you about that. All right. So if the gallstone stop at the outlet, as you know that the pancreatic duct also using the same outlet. The bile duct is using this outlet. The pancreatic duct also using the same outlet. So if the stone stuck here, the enzyme, the digestive enzyme is not successfully flow into your duodenum. And then it will flow back, right? Eventually it will flow back to your inside of your pancreas. So the enzyme will accumulate in your pancreas. Then it will make your pancreas become inflammation. Okay, the enzyme will start to attack, to melt this, to digest the cell. Okay, to digest the cell, because especially protein enzyme. Okay, the protein enzyme. It has to be secreted out here to further digest the protein, to break down, to become peptides, and to become this amino acid. But when the protein enzyme is not successfully come out, right? First thing, you will have difficulty on you have malabsorption of protein. So people are having a malabsorption of protein. They are skinny. They are not that muscular. Okay, and they are having a low metabolism. The skin looks like look like older than others. More wrinkles on the face. So all these are actually indicating they might have some disorder on. They may have some problem on protein building. Okay, on muscle building. Okay, or cells building. So the main reason will be the first thing we can consider that, which is the protein intake is not so successful. Okay, so not so successful. One of the reasons of protein intake not successful may be the blockage of the gallstone. So you see, one small gallstone can make you become can make you become this protein deficiency, right? So that's why people are saying that we are hardly to find people are having protein deficiency. Nowadays we have meat, we have food, we have everything to provide proteins to us, sufficient proteins to us. But why people are still having people are still skinny? They claim they eat a lot, but they are still not putting weight on. They are still having they're still lacking of muscle, right? Maybe because of only one small gallbladder stone, then things happen. Okay, so as I say, don't think the gallbladder stone so small and it's not so harmful. It can make it become severe. All right. So the protein enzyme flow back to the pancreas. What will happen? Please, our pancreas are made by meat, made by protein as well. So we eat meat, right? The pancreas also also one of the meat. So the protein enzyme will further attack our cells inside our pancreas. Then it will make our pancreas start to get inflammations. Start to get inflammation. So so you are started to have this pancreatitis. And if you are not treating it, if you are not reversing it, okay, give it some time, then it will further proceed into this pancreatic cancer. Okay, pancreatic cancer. And you should know that pancreatic cancer, usually people will find the pancreatic cancer. Most of the people will only diagnose the pancreatic cancer at the stage 4. Similar like liver. But good thing is pancreas will make you pain. Liver will not make you pain. Pancreas will make you pain. So when you have some chronic pain, so from front to your back, okay, you have some chronic pain. This is one of the symptoms of pancreatitis. Okay, so anyhow, if you are having some abnormal pain, you should look for professional diagnosis. All right, because it could be something serious inside the body. All right, so it will make it so with this small stone, this small little stone, it can be the root cause of the pancreatic cancer. A small stone only. And how the stone forming? Very simple. The stone forming because of the bile acid meet the fat. Okay, the bile acid meet the fat. Right. In our, you see, just like making soap. When we are making soap, we are using the alkaline. We are using this alkaline liquid mixed with the mixed with the fat, okay, mixed with oil. So when alkaline thing mix with oil, and these two things, it will become solidate. Okay, it will become crystallized. So this will form a soap. This is the simple way to form a soap, to make a soap. It's the same thing. We have this 𝗏 salt. Sorry, not 𝗏 acid. 𝗏 salt in the body. In 𝗏 salt is one of the ingredient of our 𝗏. Then the 𝗏 salt, when we take a lot of fat, a lot of animal fat, a lot of oily food, okay, then in order to digest all this fat, we need a lot of bile. Okay, bile is to help us to further digest the all this fat. Okay, so the pancreas, the liver will produce a lot of bile. So the bile contains bile salt, and you are also taking a lot of food, a lot of fat, right? A lot of fat, and the fat, a lot of fat, a lot of carbohydrates. At the same time, the liver also producing, what is that? They're also producing triglyceride, also producing fat, converting the carbohydrate into triglycerides. So it's kind of fat. So at the same time, you see your liver is producing bile salt, also producing the fat. These two things mixed together started to become crystallized, to form the soap. All right. So basically, the body, we have, when you have good proportions of the bile ingredients, the gallbladder stone will not form. Okay, but if we're having high bile salt, high alkaline of the bile, then the gallstone will be formed. All right, the gallstone will be formed. So basically, is fat. We are eating too much fat. We are eating too much of carbohydrate. Then the body is producing too much fat. Okay, so the bile make the fat start to forming some stone. Okay, start to forming some stone. So to reduce, this is why people are eating a lot of fat, high oily, high fat food. They are having more chances, having higher chances to develop gallbladder stone. People who are obesity also having higher chances to develop gallbladder stone. I would say 100%. If you are obesity, 100%, I can guarantee you're having gallbladder stone, because the gallbladder stone will form before you become fat. The gallbladder stone will form before you become obesity. Okay, because obesity takes time. Gallbladder stone not necessarily to take too long. Okay, so this is the gallbladder stone. So if to avoid gallbladder stone, of course, reduce the oily or the oily food. Try not to take the deep fried food. Try not to take these animal fats, all these things. Okay, and all this will help you to reduce the risk of gallbladder stone. If you are having the gallbladder stone, and we'll find some time to teach you to excrete, to detox, to do the detoxification by very simple things, by very simple natural products. You can get it, you can do it. Okay, so this is a gallstone pancreatitis. Okay, it may makes you to become one small stone may be your trigger factors of the pancreatic cancer. All right, and all this started from your dietary. That's it. And another thing is, we are talking about this autoimmune pancreatitis, AIP, autoimmune pancreatitis. See, autoimmune we have mentioned in the module 4, right? So autoimmune is many cause of this disorder, right? We have brain, thyroid, bones, muscle, lung, skin, nerve, okay, this gastrointestinal tract, even blood, okay, many disorder, including our pancreas, including the pancreas. Pancreas could become pancreatitis because of autoimmune attack. See, the autoimmune, it can attack your skin. it can attack your thyroid, it can attack your liver, it can attack your kidney. Don't you think? Will you think it will not attack your pancreas? No, so obvious over there, right? So obvious over there. So we are actually attacking it. And remember, when we are having a lot of, when we're having inflammation, we are causing further free radical attack. The free radical attack is coming with the inflammations because free radical were our friends, right? But a chronic inflammation like the small stone stuck in the at the outlet. Some enzyme is coming out, some enzyme not successfully, so have to flow back. So this small little enzyme keep in the pancreas started to make some chronic inflammation. Okay, and this chronic inflammation will come with the free radical. The free radical will further attack. Then it will become we are generating another bad cycle. Am I right? Okay, so the free radical attack is coming with so with this, and with this free radical attack, oxidative stress, free radical attack, it will make our immune system become more sensitive, become more high sensitive. So slowly the immune system will put the whole pancreas as an enemy. At first, they only treat some mutated cells, some damaged cells as the enemy, because the immune system have to clear off the dead cell. Remember, the T cell has to kill the damaged cells. All right, but with a long-term inflammations, the immune system will keep on attack, keep on working on the pancreas. So slowly it will not recognize only the cell. It will put the whole pancreas as an enemy. So the autoimmune will continue attack the pancreas, become this autoimmune pancreatitis. Okay, so the autoimmune pancreatitis, basically we have two types, type 1, type 2, right? Type 1 is it is oftenly to attack the multiple organs. So not only the pancreas, like your bile duct may be attacked, and liver, salivary glands, kidney, lymph nodes, all these will be attacked by autoimmune. This is more severe. So we call it as a type 1. For type 2, not that severe. Type 2 is only mainly attack the pancreas only, but research has shown that it's about 1/3 of people with type 2 AIP also has this inflammatory bowel disease, IBD. Okay, inflammatory bowel disease also an autoimmune attack. All right, so autoimmune attack, put it simple. If we have autoimmune attack, the pancreas will be one of the target. Okay, people are lucky. Some people are having autoimmune only focus on certain part, like maybe liver, maybe thyroid. Okay, some are maybe on the skin only. Okay, some are maybe on some other glands, some maybe on kidney, but some are actually running here and there. The autoimmune attack the whole body, systemic autoimmune, just like SLE. SLE is kind of systemic autoimmune attack. It will systemic means the whole body. Okay, so it will attack the whole body. Wherever can be inflamed, the autoimmune will attack. Right, so this is a problem. Okay, so type 1 and type 2, don't have to remember this also. You just have to know that there is an autoimmune pancreatitis, because the autoimmune pancreatitis will also link to diabetes. All right, so in not only making you having this inflammation and further promote to pancreatic cancer, it may also, before it promote you to pancreatic cancer, it may also cause you the diabetes first. All right, so this is autoimmune pancreatitis, and now you see we have this pancreatic cancer. So as I say, started from the pancreatitis, regardless you are acute or chronic, both are having chances to develop pancreatic cancer. Okay, pancreatic cancer. Okay, so we have two types of pancreatic cancer. The major one is the exocrine pancreatic cancer. Why major? Because most of the cells are exocrine cell, are the acinar cell. Okay, so this is because 90% of the cells are the exocrine cells, and only about 10% are the these endocrine cells. Okay, so most of the pancreatic cancer are happening on the exocrine cells. All right, so so the most common one is this adenocarcinoma. Okay, adenocarcinoma, which is inside the bile duct, inside the pancreatic duct, the cancer happening inside the pancreatic duct. Okay, and this is the most common type of pancreatic cancer, accounting for more than 90% of pancreatic cancer diagnosis. Okay, so if you ever read some common pancreatic cancer information online or somewhere else, basically they are talking about this ductal carcinoma, which is this adenocarcinoma. All right, the major pancreatic cancer, exocrine pancreatic cancer. Okay, and for this neuroendocrine pancreatic cancer, so this is very rare, only about 5%. Okay, only about 5%, because this kind of cells also less in the pancreas. Okay, so they are rare, only about 5% of all pancreatic cancer case. The rest are the small cancer case. Okay, so look at the chart. The pancreatic cancer diagnosis, 9.7% people are diagnosed on the stage 1. Stage 2 more. Okay, stage 2 have 26.8. Stage 3 further lower will have 9.1. Mainly because of people when entering stage 3, they already get used to all the symptoms. To them, fatigue is normal. High blood sugar is normal because I'm aging. Doctors say I'm old because I'm getting older, so I have high blood sugar is normal. And then I have some jaundice, normal because my liver may not be function. So because of aging, my liver may not function so well. So everything you will think is normal because of we already get used to the subclinical situations. So people and when we are getting into this stage 3, right? It very fast promote to stage 4. Very fast will be promoted to stage 4. So many people will be diagnosed because at stage 4, because of they only realize the problems, realize the service situations in stage 4. So they only go for the people are like that. When they are really, when they can walk, they can run, they can eat, they think they are normal, but not really, right? Not really. Okay. So many people, many patients, they are 54.5% of patients diagnosed the pancreatic cancer at stage 4. That at that time will be very late already. So if you want to use something, to try something, to use some normal way, some natural way to reverse your problem, reverse your symptom, you have to start from the early stage. So if you are stage 1, from stage 1 to stage 4, it still takes months or maybe years. Okay. So you still have time to use some normal way, like changing your dietary, do some exercise, reduce omega-6, reduce this carbohydrate intakes. Then by dietary changing, it may only can help you to reverse the symptom. But once if you are entering to stage 4, it may be already transferred, or already the cancer may be already transferred to other organs. Okay, so at that time everything will be late. You have to, when you are stage 4, definitely I will recommend you to go for mainstream, to do whatever necessary you have to do to keep you alive first. Okay, then the rest after that we only try to use some nutrients intervention to help you to overcome the situation. Okay, so pancreatic cancer, yeah, remember 9% of surviving rate in 5 years observations. So people are having pancreatic cancer. If in 9 years, 9 out of 10 will be gone. 1 will be survived. The lucky one will survive. Okay, so this is a pancreatic cancer. And now we come to the diabetes. Diabetes is an endocrine problem. Yep, it's not a digestive problem. It's not a neurology problem. Diabetes is an endocrine problem, which is because of the insulin, mainly because of the insulin. See, we have type 1 diabetes, we have type 2 diabetes. Now you know that we have type 1.5 diabetes, right? Why we have type 1.5? Why not 3? Why 1? Why 1.5? Okay, type 1.5 diabetes is between, which means between type 1 and between type 2. Type 1 diabetes is an autoimmune attack. Okay, type 1 diabetes is an autoimmune attack to your pancreas, and then making your pancreas producing lesser insulins. So type 1 diabetes patient, if they go to the blood test, we can easily differentiate type 1 and type 2 diabetes patient by the insulin level in the body. How? Okay, type 1 diabetes patient, they are producing less insulin because of the autoimmune attack, causing the islet cell is not working, is not functioning, or maybe killing the islet cell. So when the islet cell die, definitely the insulin cannot be produced. So if you have a lot of islet cells dying, then the remaining islet cell will only can produce a little bit insulin. Okay, so the fasting insulin is about you should have 3.5 to about 15, something like that. Different clinical will have different range. All right. So it's about something 3.5 to 15. If you're having lower than that, you are hypoinsulinemia. Okay, you are hypoinsulinemia. If you're more than that, you are hyperinsulinemia. Okay, so hypoinsulinemia mainly because of the damage of pancreas. What will cause you having a damage of pancreas? The major problem is the autoimmune attack. All the type 1 diabetes are autoimmune attack. Okay, autoimmune attack the pancreas, and then making the pancreas is not functioning well, cannot produce the sufficient insulin. That's why type 1 diabetes, we can easily differentiate them. They are having low insulins in the bloodstream. So type 1 diabetes, they are usually the insulin dependent diabetes. They have to depend on insulin injections. Okay, so this is a type 1 diabetes. So the beta cells is killing, dying. And type 2 diabetes. Type 2 diabetes is because of excessive insulin, right? As I said, the sugar uptake, we are taking too much carbohydrates, taking too much of sugar. And when we are having more sugar in the body, we need more insulin to introduce, okay, to introduce the sugar into your blood, your cells, right? So more sugars, more insulin. So okay, this is equal one. All right, more sugar, more insulin. So nowadays we are taking a lot of starchy foods. We are taking a lot of refined carbs, rice, roti, breads, everything. Okay, so all these things are actually causing excessive sugar in the body. Then the pancreas have to produce more insulin to control the sugar. All right. So when you're having more sugar, you need more insulin. So for type 2 diabetes patient, usually they will go through a stage we call it insulin resistant before they further proceed to diabetes. Before diabetes, we call it hyperglycemia. Hyperglycemia, which is you are having high blood sugar but not reaching diabetes. When you have sugar when you have sugar in your urine, then you will be officially declared as a diabetic patient. But nowadays, doctor will not base on the sugar in your urine. Okay, doctor will base on your HbA1c, your blood, your fasting glucose, to judge you whether you are diabetes or not. So if you're having high HbA1c, which means you're having maybe maybe more than 10, 18, right? I have a patient, 18. Okay, 18 HbA1c, which is the glycation of the red blood cells is very serious. Okay, so HbA1c is one of the markers. So doctor will based on the blood test report to judge you whether you are type 2 diabetes or not, whether you need the drugs or not. Usually when you are having high blood sugar, high HbA1c, doctor will prescribe you like something like metformin, okay, to lower your blood sugars. So type 2 diabetes, we have more blood sugar, we will have more insulin in the body. So for type 2 diabetes, how to differentiate? Simple. Okay, type 2 diabetes, usually you will find high insulin in the body. High insulin in the body. But this is not applicable to those patients already having the insulin injection. Because if you bring a patient who are doing the insulin injection to test the insulin in the body, you will get very high insulin. Very high insulin, 34, 48, 55, something like that. More than 100 also have. Okay, so because they are injecting the insulin, man-made insulin in the body. So this is not applicable on the type insulin injections patient. All right. So type 2 diabetes, because of the also causing because of the insulin, because of the inflammation, the pancreatic disorder, long-term producing of this long-term in high production of insulin will also cause the inflammation, will also cause the oxidative stress. You are putting stress on your pancreas. So the oxidative stress is there. So further, it will make your pancreas become this pancreatitis as well. And also the pancreatitis may also trigger high insulin. So this is two-way. This is two-way. Either which one first? And when we come to type 1.5, what is type 1.5? Type 1.5, you see, type 1 diabetes in mainstream, they put it as the childhood diabetes, which is the people who are young. They should have sufficient ability to digest, to make use of the sugar, but they found that they are not. They're having less ability. They're having less insulin to do that. Okay, so they put it as a type 1. Then doctor will mainstream will put type 1 diabetes as a genetic defect. Again, genetic defect, but it's really no. Type 1 diabetes is an autoimmune attack. It's not a genetic effect. It's not a genetic defect. Okay. So what is type 1.5? Type 1.5, which means you are not young, but you are getting autoimmune attack on your pancreas. So you are type 1.5. So how to test? Simple, as the same thing. If you are age 40, age 50, you get high blood sugar, and you go to test your insulin, fasting insulin. You found your fasting insulin is lower than usual, then you are this type 1.5. Okay, you are type 1.5. You are not young, and you are getting autoimmune. So type 1 is autoimmune, and usually people will usually apply on young people who should have sufficient insulin to digest the blood sugar. But type 1.5 is you are not young. All right, you are not young, but you are not taking too much sugar. You are not having high insulin. Okay, but you have, in fact, you are having low insulin productions. So you are type 1.5. Okay, autoimmune attack. All right, so all these are related to your pancreas. Related to your pancreas. All right. So this is the chart that let you know that how the pancreas work with the liver. Okay, so when we take sugar in, the pancreas will secrete insulin. So the insulin will stimulate the glucose uptake. Okay. At the same time, the insulin will stimulate the glycogen formation, which is the storing sugar. Okay, the storing sugar, the glycogen in your liver. Okay, so this is a spare energy. When you have no food to eat, when you're hungry, then the pancreas will secrete the glucagon. Okay, the glucagon then to stimulate the glycogen breakdowns for your body to have some energy, this is a backup energy. So the pancreas is working like that. When you are taking food, it will secrete insulin. When you are hungry, it will secrete glucagon. When you are low energy, it will secrete glucagon. Okay, so to regulate these two, to regulate the glucagon and insulin, you need to have this somatostatin. So somatostatin got two types. One is insulin inhibitor, another one is glucagon inhibitor. So it will inhibit either one. We haven't seen any somatostatin can at the same time to inhibit two insulin together. Okay, either this one more or this one more, insulin inhibitor more or glucagon inhibitor more. So depends on the situation. If you need more sugar, then the glucagon, then the insulin inhibitor will come. Okay, to further break down the glycogen. But when you are having too much of sugar in the body, then you need to make yourself to uptake from the food to uptake the sugar. So the pancreas will secrete the glucagon inhibitor somatostatin to inhibit the glucagon secretions. Okay, so this is how it works. All right. So insulin and glucagon, these two are more regulating your blood sugar. And nowadays people are mainly having high insulin level in the body. Okay, high insulin level in the body. And if you are having high insulin level in the body, then you are on the way to diabetes. Okay, so if you are having high insulin in the body, you are on the way to diabetes. So the first thing to test your diabetes risk, you may go to test not only your glucose. You can go and test glucose. You may test every day you test your glucose. You found that 5, 5.1, 5.2, 4.4, 4.9, 4.8. Idea. Okay, you see your daily glucose, your blood glucose are normal. But who knows how much insulin you have to use to regulate the blood glucose, right? Maybe your insulin have to use 2 times, 3 times, 4 times, 5 times to make your blood glucose to maintain the normal range, around 5, around 4.9, around 5.2. Okay, right. So when at that time you're actually experiencing the insulin resistance, and even though you are having normal blood glucose, you maybe next day, next week, next month, you will become diabetes because the insulin resistance is ongoing. One day, the pancreas become fatigued, then the insulin promotion is not that sufficient, then you will become diabetes. Or the insulin still produce so much, but the cells is not sensitive to the insulin anymore, right? So also you will become the diabetic patients. Okay, so this is a long-term process. It's a chronic process, right? It's a chronic process. Different than the autoimmune attack. Autoimmune attack is more acute, faster than this. The type 1 diabetes happening is faster than type 2 diabetes. Okay. So what are the symptoms of pancreatitis? Belly pain. The belly pain is a first symptom. Okay, then the belly pain will spread to your back or up to your chest. Okay, and especially after you take the meal. Especially after you take the meal, the belly pain, the pain will be more obvious. If you're having this kind of symptom, don't think this is your stomach pain, your stomach ulcer or anything. It could be the pancreatitis as well. Okay, so then the other symptoms are quite similar to liver disorder, like nausea, vomiting, rapid heart rate fever, swelling and feeling sore or tender in your upper belly, fluid build up in your belly, okay, and lower blood pressure. But usually liver disorder patients are not having lower blood pressure, okay, but the same thing is they are having this yellowish on the skin or the eyes, okay. So sometimes based on the symptoms, we cannot accurately to pronounce the disease, okay. But we can go for some simple tests. We can do some tests to observe our own self. Okay, so how to do the self-observations? Very simple, and this is also if you have chance to take a look into your friends, your customers, blood test, then you can look into this one. Then it may tell you something. All right, it may tell you something. First, of course, to observe your pancreas. To observe the pancreas, first thing by the physical side. If people who are having obesity, okay, they might have this insulin resistant, and insulin resistant is very near to pancreas disorder, very near to pancreatitis. It's a kind of pancreas disorder also, okay. So fat people, they may have this, they are having high chance. People who are too skinny, they are having pancreatic disorder as well, right? The Acinus cells is not producing, or the blockage of the gallstone, making the enzyme is not flowing to the duodenum. So making the digestion of proteins and other foods are not successful. So people are having this pancreatic disorder, may also have this malabsorption problem. Okay, so this is for physical by eyes. Maybe you can see but it's not accurate. For more accuracy, you can go for the blood test simple. Okay, fasting glucose, if they are having high fasting glucose and are having this high fasting insulin. Okay, and having this high HbA1c. Sorry, I forgot to put in the HbA1c. Fasting glucose, fasting insulin, HbA1c. These three things is indicating the diabetes situation. When people are having the diabetes problem, definitely the pancreas is having disorder. Either too much insulin is producing, or too less insulin is producing, type 1 or type 2 or type 1.5. Okay. Further, to know more about the pancreas is pancreatitis or not, you may perform the CEA test, CEA markers, and the CA199. All right, these two are the markers will pronounce the pancreatitis. Okay, the higher level, especially CA199. CA199 is the pancreatic cancer markers, tumor cancer markers. So people, if you are having pancreatitis or pancreatic cancer, the doctor will observe you. One of the markers is this CA199. Very accurate. Okay, CA and CA199, very accurate. But of course, if you are having high CA199 or high CEA, it may be because of some others problem. Your liver may also cause inflammation, may also cause CA199, CEA rising. The gastrointestinal inflammation may also cause it rising, right? So this is, if you are already diagnosed having this pancreas disorder, then these two will be the observation markers. If you are not, and you are seeing these two are getting higher, yes, you are having higher chance of a pancreas disorder, but it may be indicating some other thing also. Okay, so many cross-examination you have to do, right? But at least it can tell you something. Okay, by these two, it already can tell you something. The pancreas is having high chance if they're having the high on CA199 and CEA is having high chances of this pancreatic disorder, pancreatitis. Okay, so and then urine test, of course, to test the urine glucose, which is if they having urine glucose which means they are diabetes. And if they are diabetes, definitely the pancreas is already in trouble. Okay, so this is a way to observe your pancreas. And how to protect your pancreas? Again, the triangle is very important to get the optimal health. Your dietary you have to go for your dietary first. First thing, definitely you have to control your dietary, change your dietary. Okay, less omega-6, less inflammation food, less deep fried, less oily food. All right, less refined carbohydrates, less alcohol. Okay, less drugs intake. Okay, avoid the heavy metal poisoning. We would not know what contain heavy metal poisoning. Okay, we would not know, even though the cookware that you are using, may contain heavy metal also. Okay, so like the animal proteins, the dairy products are also causing a lot of inflammations, and the fructose also indirectly causing the diabetes. Okay, so all these are the you have to avoid, right? You have to avoid refined carbo, alcohol, inflammatory foods, drugs, heavy metal poisoning, animal protein, high fructose, all this, and so on, and the rest of so-called unhealthy food, snacks, okay, sugary drinks, soft drinks, okay, smoking, all these we have to avoid. Lifestyle, of course, don't stay up late, and don't take too much food at the same time to make your pancreas too much busy. All right. So less food, more frequent. I would say this is better. So instead of taking 3 meals a day, every meal taking very heavy meals, you may say split to six meals a day, but every meal you take light meal. That would be good for your body as well. At last, then you can take some nutrients to take care of your pancreas. So what can we use to do the intervention to take care of our pancreas? First of all, zinc is very, very, very important. This is always recommended. First thing, recommended zinc. All right, zinc, as I say, zinc is over 300 enzymatic reactions are cofactor, and zinc is rich in our pancreas. All right, zinc is rich in our pancreas. Zinc is very important to all the glands. All the glands need zinc. In my zinc product training, I already told that everyone needs zinc. Every gland needs zinc. Zinc can regulate our glands working situations. Okay, so zinc is very important, and zinc also a kind of antioxidant, strong antioxidants. We need zinc. All right, every gland needs zinc. And in India we have 𝗪𝗪. 𝗪𝗪 is to lower. 𝗪𝗪 is kind of Indian herbs, and 𝗪𝗪 is used to lower down the blood sugar, right? And from ancient until now, the study is showing that 𝗪𝗪 is lowering the blood sugar. But 𝗪𝗪 is not promoting the blood sugar intake. Actually, the 𝗪𝗪 is to reverse the is to repair your beta cells. The function of 𝗪𝗪 is to repair your beta cells, to protect your beta cells. So to make your beta cells back to normal or even optimal working situations. Okay, and also avoid the beta cells dying easily. Okay, so it is supporting the beta cells. So by supporting the beta cells to secrete sufficient and quality insulin to help you to lower down your blood sugar. Okay, so 𝗪𝗪, don't expect you take 𝗪𝗪 immediately your blood sugar will go down. This is not the way. This is not the way that work. Okay, taking 𝗪𝗪, you have to take longer time. Take longer time. Remember, every customer come to us, we have to give them another concept, which is the 180-day cell regeneration concept. The total cells regeneration, the metabolism of our cells, total cells regeneration take up to 180 days. Because our pancreas, because our liver cells take 180 days to completely to regenerate all the new cells. So in order to generate a new cell, a batch of new cells for overall the whole body, we need to take up to 180 days, which means if you want to take nutrients, if you want to try the natural way, at least you have to give yourself 180 days time. Just like me, I took 180 days from 89 kg lower down to 75 kg. I took 180 days to lower my insulin, my fasting insulin from 25 to 3. You see, 25, I was in insulin resistant. From 25 to 3 point something, if I'm not mistaken. Okay, something can be lower very fast, like the cholesterol. Cholesterol, I'm only using 1 month from 7.5 to 4.8, and in 6 months time, all my symptoms gone. All my symptoms gone. My hyperglycemia gone. The blood sugar is low. My high blood pressure is gone, back to 120, 80. My blockage in my V6 gone. My blockage in V6 gone. No more. Go back to the doctor. Doctor said no more blockage, right? So I was diagnosed. My V6 got a blockage. My one of the coronary blood vessel is blocked. Doctor will suggest me to take to put the stent or to take long-term medications. I choose not for two. Then I turn to the natural way. That's why I turn to the nutritional medicine. Then with the nutrients and the dietary lifestyle changing, 6 month time, I changed myself, completely changed myself. Okay, you may not know me, but people who know me before, like my wife, okay, know me for so many years. She is watching my changing, you know, my wife, my kids, my parents, my friends, they are watching my changing. Okay, so give yourself 180 days, give yourself 6 month times, all right? And the same thing, same concept, please promote to your customer, promote to deliver to your customer. Tell them if they want to try our products, right? At least give themselves a 6 month time. Give themselves a 6 month time. After 6 months, they only judge whether we are helping them or not, right? Because you took 40 years, 50 years, 60 years time to build a bad health situation, and you are expecting expecting the 𝗪𝗪 can lower down your blood sugar by 1 tablet. This is ridiculous, unrealistic. Okay, so nutrients will go to the root cause, to solve the root cause, not to remove your symptom. If you want to lower your blood sugar, immediately take metformin, inject the insulin. Okay, if you want fast, don't come to us. If you want fast, go to mainstream. Mainstream will give you very fast treatment. But this is not to the root cause. Only remove your symptom. Okay, only remove your symptoms. So 𝗪𝗪, and we have a grapeseed extract. Grapeseed extract. Grape extract is okay. We have 2 types of grape extract. Grape extract selling. Some are using grapeseed extract. If grapeseed extract, mainly the components are 𝗪𝗡. 𝗪𝗡 is a kind of an antioxidant, very strong antioxidants. Grapes extract are mainly of resveratrol. Okay, resveratrols are extract from grape skin. Okay, grape skin. And people are so smart, then they tell me, they will say, oh, then why I have to take your zinc, why I have to take your 𝗕's product? I go buy grapes, right? A lot of grapes. I know India, Malaysia, Pakistan, these are Bangladesh, right? Even though everywhere are having this having grapes. Grapes is so easy to find. So why don't I take grapes? I can buy grapes, okay? I can eat every day. Then I also getting the grapeseed extract and grapes extract, right? I'm taking the skin, taking the grape skin and the grape seed together. Yes, you are taking the grapes extract, grape skin and grape seed together. You are taking some little amount of resveratrol and little amount of 𝗪𝗡, which is not sufficient to handle your daily oxidative stress, right? And at the same time, when you take grapes, what is glucose? Glucose are actually the name from grapes, right? The sugar from grapes, we call it glucose. This is a name. This is a name. The original name, the glucose, which means the sugar from grapes, right? The sugar from grapes. Okay, so this is the most simple sugar. When you are taking grapes, you are taking a lot of glucose, and it is causing you having a lot of sugar in the body. You are taking a lot of sugar in the body. So don't be too smart, okay? All right. Sometimes just follow the simple instruction. Our grapes extract and grapeseed extract, our resveratrol and our OPC is enough, sufficient to handle your oxidative stress. So grapeseed grape extract will further reduce our inflammation of this pancreatitis. Okay, 𝗕𝗶𝗴𝗏 also, which is a green tea extract. Green tea extract also and antioxidants, right? Omega-3 also anti-inflammation. So if you're having pancreatitis, because most of the symptom will link to pancreatitis. Okay, so if you're having pancreatitis, of course, antioxidants, anti-inflammation, you have to take, right? So omega-3, and in Hong Kong we have this seed button oil, seed oil, also a very good anti-inflammation oil. Okay, and we have cordyceps and chitosan. You will find that the products are good to liver, will also good to the pancreas. They are brothers. They are brothers. Okay, pancreas and liver are brothers. So if whatever benefited to liver, it will benefit to pancreas as well. So cordyceps, chitosan is good to liver and also good to the pancreas. 𝗪𝗔64 in India also, 𝗪𝗔64, the 4 major ingredients all pointing to liver and also pointing to the pancreas. Okay, also pointing to the pancreas. And some countries are selling this calcium, like sultan calcium or calcium with this glucose metabolic functions. Okay, and this is mainly to reduce the calcium. To reduce the glucose and to relieve your pancreas, make your pancreas not so hardworking. Okay, what else? What else? Like, okay, if you're having blood sugar problem, you should take also taking magnesium and chromium. Magnesium and chromium will promote the blood sugar burning in the cells. Okay, so magnesium, chromium are also important. What else for pancreatitis? I think mostly are there. Okay, mostly are there. So, all right, this is today pancreatitis. Thank you very much. Before we end, let's see we have any question or not.